So good afternoon. My name is Cheryl Nickel, and I am a clinical social worker with the Counseling Center here at Texas State. And I am going to talk with you about navigating campus and community mental health resources. If at any time, if you are in the live broadcast and would have a question, you're welcome to drop that in the chat, and we will answer that probably at the end or throughout if it's relevant to what we're talking about. And if you are watching this on recording, you have my email address here, cln81@txstate.edu. You're welcome to email me if you have further questions. We will go ahead and get started then. I wanted to share just some general mental health information for those of you who might be interested. National Institute on Mental Health and NAMI are very good resources to read about different mental health concerns and things like that. The rest of my resources are going to be more local and specific to our campus, but wanted to share that information as well. There's a lot of good stuff out there. And so when you're looking at mental health resources, you see a lot of different areas. This is definitely, I don't think, everything, but it can be specific to mental health concerns. And our campus does a good job of addressing all of these in some capacity or offering support if we don't do it on our campus. And hospitalization is really the one thing that we don't do here, but we will support someone who needs that to get that resource where they can. And so we're going to talk about these different things. But first here, down on the bottom right, I've got other community resources. And I think it's important to recognize that mental health and general health, general daily living are all intertwined. And so it's important that we are aware of other community resources that can impact our mental health, such as those listed. And 211 Texas is a great resource for this information. And if you'll notice, Maria is dropping these different links that I'm showing in the chat. And so if you're able to see the chat on the live, you'll have those links as well. Campus resources involve quite a few things, and so we're going to talk a little bit about those also. Minds Matter is a good resource that has 10 different categories for students, friends and family, and faculties and staff. It covers these different areas and is a website that you can go to through our Texas State website and check that out. So that is something that is available to anyone who has that link. Now, when you're looking more specifically at campus services, the Student Health Center also promotes their providers in assessing students and assisting with different mental health concerns. And so you can see here, I took this information directly from this link on their website, that their primary care providers very much participate in evaluating and medical management of common mental health concerns. And then if there's something beyond their scope, they will consult with or refer to a psychiatrist. You've also got the Assessment and Counseling Clinic and CARES Clinic here on campus. And those are different resources through different departments, academic departments on campus that offer practicum sites for students to provide services to our students and the community. And you can read about those at those links as well. Now, the Counseling Center offers a variety of services within our center. And you can see here, those are listed and found with more information at our website, counseling.txstate.edu. First and foremost, we offer crisis support. Our phone is answered now 24/7 with the 512-245-2208, where you can access a counselor to, if you're having an immediate suicidal thought or recent death of a loved one or recent trauma, we want to support you and guide you through that process. We also have a variety of self-help resources that are very accessible and free, of no cost to students. And so, or anyone in the community for that matter. And so you can take a look at that. The Therapy Assistance Online is an app available to students, which addresses anxiety and depressive concerns, as well as other common concerns that college students are experiencing. And students have reported that using that has been beneficial, especially in supplementing therapy, or sometimes they may not need to go to therapy, but need a little bit of assistance or guidance on kind of what they're dealing with. And so that can be helpful. We also have the mental wellness videos, and we're updating those often with different topics on stress management. There's some breathing exercises demonstrated on that link as well. And then a variety of mental health podcasts, audio tracks, videos. There's a mental health screening online tool, racial trauma, violence, and anti-racism resources, as well as COVID-19 resources that can be found under that tab on our website. We also offer community referrals. That is my main role at the center, is helping students who need to find therapy or other services in the community. And an appointment can be scheduled with me to do that. Our clinicians also help students that they're working with if they need to go further in the community, or they're graduating or moving and need to get situated with a new provider. We can offer that support as well. We also offer the educational outreach, the at-risk training, events and workshops, webinars such as this, to the larger community of students and staff, as well as do presentations on request of various topics that are needed. And then our clinical services, we offer group therapy on a variety of different topics, and those can be listed under the group therapy tab on our website, and cover a large list of topics, including for this semester, we've got mindfulness, moving through grief, support for managing bipolar, facing the fear, overcoming anxiety and panic, and a lot of other group topics that students find beneficial. You can take a look at that list, and if you are interested, we are taking interest list for our spring semester groups. The schedule remains to be determined, but if you're interested, feel free to call the counseling center and be placed on that list. The counselor will call you as it gets sooner to the semester to discuss whether that group sounds like a good fit for you and if the schedule will work. And then for counseling, we do offer on a brief model the individual and couples counseling. The brief model includes therapy sessions that could occur every 2 to 3 weeks. Towards the end of the semester, as our schedules are fuller, we convert to end of semester sessions or single sessions, as we are now, which provides the student a session with the counselor to discuss what's going on and identify some skills and strategies, and then potentially connect with resources or get an appointment with the case manager or myself scheduled so that we can further link you with services in the community. So what I'd like to talk a little bit more in depth is about finding a provider for individual counseling in the community, telemental health information, navigating insurance, and low-cost therapy. So I'm going to switch screens. Okay. When I was referencing the Counseling Center's website, I just want to point out the different tabs. So you've got our services tab, the group counseling tab that I was mentioning, with the list of the groups and their descriptions. So you can go and read those. Some of the information I'm going to talk about today, I will reference that you can find it on this website. And this is the page that I'm talking about under community referrals. We also have information about crisis and some different resources there. Back into the services tab, you've got information about making an appointment. We do online scheduling. And so you can read through this if you are a new client with a non-urgent matter and wanting to talk with a counselor. This is the tab, the area that you would select. If you're having a crisis and meet one of these conditions, then you would want to select this or and read further and then call our number to talk with someone. Our self-help resources that I mentioned are all here with the Bobcat mental wellness videos, the breathing exercises, and a lot of other things described and accessible at these links. So with finding a counselor, it can be an overwhelming process. And I think that that is something that students often say to me, is that they just don't know where to start. And so that is something that hopefully this will help you identify. And there's not one way to do it. I'm going to try to identify several different things here for you, and hopefully the information will make sense, and it's also in written form. So most of the writing that you're looking at here is in a document on the page that I referenced before here on our website under community referrals. And I'll reference which document that these are located in as I'm talking. So here under the guide to finding a provider in the community, you have a description of kind of what the different providers are. A psychiatrist being a doctor who prescribes medication versus a therapist, counselor, clinician. As you can see, these titles are all used interchangeably. So that can be confusing as well because you have psychologists, professional counselors, clinical social workers, and even licensed marriage and family therapists. So one way to find them is to do a search on a variety of databases that exist on the internet, Psychology Today being one that has existed for a long time. A lot of our local therapists are still listed in it. And so it is one that you can go to and check out. I also have several others that are newer, but are being populated quickly. You will often find the same therapist in all of them, but maybe not every therapist in all of them. Some of them do cost to list, and so some therapists choose not to do that. And so that is one big way to find your therapist. We'll talk later about insurance and how to go about getting the insurance company to send you a list of people that are on their insurance panels. So one thing that I have talked with students about that gets very overwhelming and produces a lot of anxiety is making the phone call to a provider, not knowing what to ask or what's going to happen when they answer the phone. And so I definitely talk with students about the fact that most often the therapist isn't going to answer the phone. Most therapists work independently, which means they don't have a receptionist to answer the phone and take a message. It's not like calling the doctor's office where somebody answers the phone. And so you're going to find yourself leaving a voicemail or sending an email. That can be overwhelming and intimidating too. What do I say? So I've put together some helpful hints here. You want to make sure you leave your name and callback number, as well as a few topics that you know you want to address in therapy, like anxiety, depression, trauma, etc., whatever those issues are. But definitely be brief, and be mindful that if you do send an email with this information, email is not a secure way to communicate information. So you don't want to include your whole story. You just want to be brief on the details, because you're really trying to find out, are they taking new clients? Do they have openings? And, then you can go into the details when you do talk to them. Another one of the helpful hints is letting them know if you have insurance and what company that is with, or if you are going to pay out of pocket, if money is tight and you might need a lower rate than what their full fee is. That is what we call sliding scale. Many therapists are willing to talk with clients about their financial situation and lower the rate accordingly. And oftentimes they will do that for students as well, when they are in need of that kind of financial support. So something to ask about, but that's, if you're not using insurance. And then with the pandemic, therapy went virtual. It was virtual before for some providers, but it was not as prevalent as it is now. And so now you're seeing a lot of therapists still virtual. Some have went back to the office as well and are doing in person and virtual, and others, a select few, are only in the office. Most people are still doing telehealth, even if they're in person. So the only way you're going to know that is by asking. The websites, some of them are updated, but many, circumstances change. And so, talking with the provider to make sure that their plan matches what your preference is, whether you prefer in person or telehealth or you don't, it doesn't matter. Recently, I put those helpful hints in a script, and that has been well received by the students that I work with. So that is here, and it will be on the form that I'm going to show you in a minute that has this information that you can download from our website. As you can see, you just need to fill in the blanks with your personal information, and you can say that on a voicemail. If somebody answers, you really, it's short enough, you could say that to them, and you could throw that in an email, cut and paste and put it in the email. So it's very basic, and brief, but gets to the points of the information you need to find out if they have openings. Okay, so as I said, all of that information is found here on this document. Oh, and something goes wrong, of course. Okay, well, it's the guide to the off-campus mental health referrals, and it is located at our website under number 1. And she's working on updating it as we speak. So this is not the current form that I'm referencing, but it will be there within the hour. But you can see also another thing we're going to talk about is insurance, understanding your insurance benefits, and that is in this section of this document as well. But the information I just went over will be in these 2 sections by the end of our webinar. Okay. I do encourage, if people are in the live, if you have questions as we're going through, feel free to write that in the chat so that I can make sure to address them as well. Okay, so then we're going to move on. I mentioned telemental health. So that has become a big thing, obviously, since the pandemic. And so I've got some information here on navigating it with insurance, as well as just finding a provider, whether you have insurance or not. Insurance had different rules kind of before the pandemic, and now with the pandemic, excuse me, they softened those rules. It's expected that many of those changes will continue, but we are in kind of a wait and see. And so I encourage students to ask their insurance company about any specific circumstances related to telemental health, so that you are informed if there's any cost changes. Sometimes we are seeing that telemental health through a certain company that the insurance contracts with will not cost you a copay, as opposed to using telemental health or in-person providers in a different way. So that is something to call and ask your provider, your insurance company, about as well. And I do have some of that information listed right here, where you can call and ask these questions. Another thing to be mindful of is that you can go on your insurance company's website. We'll use Blue Cross as an example here, and they will have a telehealth or telemedicine page. So, you can Google for that and check that out. As you can see here, it talks about virtual visits powered by MD Live. MD Live being a telehealth company that's contracting with Blue Cross, and you can log in and get signed up. And this allows you to see a lot of different kinds of doctors that can be seen virtually, not just mental health, psychiatry, or counselors, but therapy is one of those options. So that is something to be mindful of if you're using insurance and want to check out their program. You can see that TRICARE, United Healthcare, Aetna all have their providers as well listed, and kind of how that works with the phone numbers. And then, as I said, there's a lot of different just telehealth companies, MD Live being one of them, but these are a bunch of other ones as well, and they are listed on the handout that you will be able to download from our website. These are not the only ones that exist, but these are just a select few for no specific reason other than some of them have been around longer than others. And this is another document that I will have available on the website that I was mentioning, where you can get the information from this page, including these specific links for the Blue Cross, telehealth, United Healthcare, Aetna, TRICARE. And again, if your insurance company is not listed, you should be able to Google or go onto your insurance company's website and search for telehealth, telemental health, telemedicine, any one of those phrases, or call the number on the back of your insurance card and ask. A lot of times the number on the back of the card, there's several numbers. If you have a number for member services, behavioral health, and sometimes there are numbers for telehealth on those insurance cards or websites. So, keep your eyes open for that if you have your insurance card accessible. But you can see I've listed all of these resources that are on this page here in this handout. Okay. So then with navigating insurance, something you want to find out first and foremost is who is the insurance company. A lot of times students are still being young adults, they're covered on their parents' insurance. Many times you either have the physical card or you have been given a picture of the card, which is fine, as long as you have the name of the company and the member ID, the group ID, those kind of things. You can find out what you need. And I'm seeing that most often students, even if you're on your somebody else's insurance, whether it's your parents or a spouse, you should still be able to call the number and get the information you need about your benefits because it is your insurance. I do not hear very often that it requires the policyholder to do that, although it does sometimes, but I don't think that is common. And so this will walk you through doing that if you were going to call on your own. I encourage people to call at a time when you have a little bit of time to sit on hold, because sometimes you might need to wait a little bit. You're going to call that number and you're going to follow the prompts. hopefully till you reach a person, but you might have to check a prompt that says you're wanting to, or verbally say it, that you're looking for insurance benefits for behavioral health. Again, a couple of interchangeable terms: behavioral health, mental health, go hand in hand in the field with what insurance companies might be using. So then you want to let them know that you're looking for coverage for individual counseling. Have a pen and paper ready, because they will give you, or should give you, information about your copay, your deductible, and coinsurance. I've got a description down here that explains a little bit more about coinsurance, but some policies have copays and you don't have to worry about deductibles and coinsurance. Others do not have copays, and you do have to meet a certain deductible, which is a certain dollar amount, and then pay a percentage of the bill after that. So every policy is different, and every Blue Cross deals with a lot of different entities and has a lot of different policies even within their own company, same as United and so on. So there's no standard understanding of that, and so you really do need to understand your own benefits, which is why calling and asking is the most helpful, I think. Especially if you're new to insurance talk, then having someone talk you through that can be helpful. However, you can go to their website. Often that is listed on your insurance card as well, or you can Google it and find a login button where you would log in as a member, or you might have to create your login. And then you can read about your policy there. Some websites are easier to understand than others. So again, I often encourage people to call to get that information from a representative. Another thing you can do is you can request the insurance company to email you a list of therapists. Again, going to these database search engines can help you find therapists that take those insurance. It allows you to filter for insurance companies and has many insurance listed in those platforms. However, if you're in a rural area or you don't want to mess with looking at it, you can just ask the insurance company to email you a list, or you can often access it through their website by putting in your zip code and the kind of person kind of doctor or therapist that you're looking for, and pull it up that way as well. And then you can even cross-reference some of these other websites, or Psychology Today, and those kind of databases have more information than the insurance website is going to have. A lot of times the insurance site is going to have the name, phone number, and address of the provider, but not a lot of details about their interest areas or the kind of client that they work best with. And so you can find that more on the therapy search websites like Psychology Today or Therapy Den, etc. And so if you find someone on your insurance site, you could take a look and see if you can find them on one of those sites, or find them on their website to read more about them and see if they feel like a good fit. It's still hard. It's not an exact science, because keep in mind, finding a therapist is a very personal journey. It's about the relationship first and foremost, and you're not going to know that by a picture and a bunch of words on the internet. So, but hopefully it gives you kind of a sense of direction to go in, so that then you can make that first contact and feel comfortable doing so, to decide then if this person is a good fit. If you want to see a therapist that does not take your insurance, but you like everything about them, then you might want to choose this option, and that is to see if your insurance company, if your policy has out-of-network benefits. And what that would mean is that you would pay the therapist the full fee that they charge you, and then insurance would, you would submit the receipt essentially to the insurance company, and the insurance company would potentially pay you a percentage of what you paid. Sometimes that ends up being kind of even as if you had seen someone that is in network. And there are advantages to do that. A lot of people don't want to mess with it, but it is an option. And so if you were wanting to do that, you would want to verify that your insurance company and your policy specifically has out-of-network benefits, because not all policies do. Not too often do we come across session limits, but I left that question on there that you can check. They usually, therapy is typically determined based on medical necessity, and so there's not a way for them to formulate how many sessions that will warrant. And then finding out if you are able to access an employee's assistance program can be significant, and that is explained a little bit more here, but it is just a benefit from an employer policy. A lot of times through that workplace, they have what's the employee assistance program, which has different resources. And one of them is the ability to see a therapist for a select amount of sessions. And that's where there would be a limit because it's a brief resource, often 5 or 6 sessions that are allowed for free. And the content of those sessions is not reported back to the employer or the policyholder. It's just data about how many people use it. And then that therapist, if they take your insurance, they could continue to see you under the insurance, or they would help you connect to somebody else if you still needed to continue to see someone in the community. And then lastly, when you're talking to insurance, again, asking that question about if there's any coverage difference for in-person or telehealth, and then what that specific company is that they might contract with that you might want to use, especially if there is no copay to use telehealth through that company, then they will give you that information. So all of the details of what I just went over is located in this document, the Guide to Off-Campus Mental Health Referrals. And then lastly, if you do not have insurance or you don't want to use your insurance, and that comes up definitely, then you've got the option to pay out of pocket. And many times people who are doing that might be limited in their income, especially if you're a student going to school and full-time and not having as much of an income right now. So needing to look at low-cost options for counseling. So the resources in our area, one is going to be Open Path Collective. It's another database for therapy search website, and I can actually show you, where you're going to put in your zip code, or they do have online versus in-person options. Most of the providers I see in our area look to be telehealth only right now. That might change down the road, but you can select the state of Texas for telehealth. That just means that you have to be in the state of Texas when you receive services by a therapist that's licensed by the state of Texas. And that's something on a side note with the counseling center, that we have to verify that you're in the state of Texas when we see you for counseling also, or we cannot do that. It would be against the rules of our license to be treating someone that is not currently in the state, even if you're just on vacation. So with this search, you've got a lot of different options. You can go down and filter for race and ethnicity, other specialties, modalities, treatment orientations, age specialty, language specialty. And specialties can be things like anxiety, anger management, depression, trauma, addiction. You can see there's a lot of different issues you can type in and see what comes up as to the therapist. And with this database, it's low cost being $59 for a one-time fee, and then you can access their therapist for $30 to $60 for individual counseling. Now, another agency in New Braunfels is River City Advocacy. They are doing in-person as well as telehealth, and they offer low-cost therapy options to area residents and students of Texas State. So if you were in need of that, you can check them out. There are times where they are full and not able to take on new clients. So their website usually says that, and they have an application on the website that you would complete to do that. I mentioned earlier, Texas State has an assessment and counseling clinic here on campus, and that's where the counseling students are able to offer within their practicum and being supervised counseling services to other students. And so that can be an option. They fill up quite fast at the beginning of the semester, so it's encouraged to give them a call so that you can see them, but they offer weekly low-cost therapy. And so that can be a great resource as well. And then the Samaritan Center is another option. They're out of Austin, but they've had a therapist located in Hays County and continue to serve us in this area, and so they can be a good option as well. They are also, while they, both Samaritan and River City serve the general population, they also have some specific services for veterans as well. And so that's something that if you're a veteran student, you can check out. And a lot of those resources, as well as others in the surrounding areas, are listed here on this document. And this is the sliding scale fee low-cost counseling document that you can find on our website as well. So I think I have covered everything that I wanted to cover today. Is there any questions in the live, in the chat? Anything, any resources that you're looking for more specifically that I can help you with? Okay, I'm not hearing anything else today. So again, the offer still stands. You have my email, cln81@txstate.edu if there's further questions down the road, or once you look at the resources I talked about. If you're unclear of something or wanting to see, get more information, let me know. And with that, then I will wish you well and have a great day. Thank you for joining us.